This is the Mid-America PTTC podcast, where we believe prevention is better together, and together we are stronger. I'm your host, Steve Miller. This is episode 54, and in today's podcast, I have the pleasure of speaking with Kimberly Nelson, Kim. She is the United States Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, Regional Administrator. Kim has served Region 7, Kansas, Iowa, Missouri, and Nebraska since 2015, and has worked in the behavioral health care field since 1992. Perhaps most importantly, Kim is a person in long-term recovery and is a licensed addictions counselor and a certified peer support specialist. Her foundation in clinical work in the community or with serving criminal justice clients, and a stint as a Medicaid coordinator, ensuring alignment with addiction services, demonstrates that Kim is passionate about guiding systems toward change. In her current role, she wears many hats on any given day. But that makes her uniquely qualified for our discussion today about recent data trends and how the future of harm reduction fits into the prevention of tomorrow. Before we get into the content, we would like to thank our funder, the Substance Abuse and Mental Health Services Administration. Quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. We've got a lot of ground to cover, so let's get started. Well, welcome to the podcast, Kim Nelson. We're certainly glad to have you here today. Settle in. I think we're going to have a great conversation. And my first question's always the same. I know we've identified yourself as a person in long-term recovery, and you spent a lot of years working with SAMHSA and in and around the prevention, recovery, mental health realm. But I'd really like to know, what was it that was your path into the work that you do, your path to prevention, if you will?
Thanks, Steve. Thanks for having me back again to the PTTC Prevention Podcast. Honored to be here. My work has been, a circuitous path, to say the least. So having been fortunate to get into recovery at the age of 23, based on a family intervention. My initial work focused early on with with families, in family recovery settings, in women's treatment programs that where the women brought their children with them into treatment. And that was a very novel concept, in the late 80s and early 90s. And that's what we were doing. And so, in those days, there was kind of this thought that treatment and prevention were almost pitted against each other. They were different. They had different goals, different things happening. And treatment would look at prevention and say you're too uptight, and prevention would look at treatment and say you're too loose. And, we just, there was just this schism kind of. Well, in a family-centered treatment program like we were operating, there was no space for that. We had to do both. And we valued looking at families, because substance use disorders, as we know, affect families. They don't just affect a person, right? They affect that person and everyone around them. So very early on, I was very appreciative of prevention work that happened in our center, with our kids and with our moms. So we brought a prevention specialist into that center that did strengthening families. I'm sure some folks know that model. And it was very powerful. We also had parenting classes and skill building, work that we did with those families while we tackled addiction, substance use disorders from that family perspective. So to me, on top of that, then as a person in recovery who has a family, right, who has kids, it was so important to me to be giving into the prevention kind of work and systems and coalitions and school, the work that was happening in those places for the benefit of my kiddos. So it's a completely natural uh, relationship to me between, my recovery and recovery communities and prevention. I just think, one really feeds into each other. They feed into each other really nicely. Lastly, I guess I would say about my journey with prevention is kind of related to our topic here today around harm reduction. I got into recovery at 23 from my alcohol and drug use. I did not get into recovery from my nicotine addiction at that time, or into recovery from my sugar addiction at that time. In fact, those things got a little worse, the theory of substitution. And so eventually, some years into, and part of what prompted this for me was kids in school being taught about nicotine, and smoking, the prevention, the public health prevention part of smoking, was not okay. That was being taught to children, my children, who would come home to me, a smoker, and complain about my smoking in the house, in the car, in places where they were exposed to it. And I started feeling guilty, and that really led eventually for me into, I then happened to be at a health fair where a very, specifically trained smoking cessation public health person was there. And I talked to her at that health fair booth. And she said something to me that has stuck with me forever. She said, even if you smoke one less cigarette a day, you'll be better off. And that was my first exposure to harm reduction that hit me at the core. And I said to myself, wow, I can do that, you know. And then that led to a journey for me of using harm reduction to be able to stop smoking. And man, that really started to move me. I had one last thing about this. I had gotten sober, gotten into recovery in a very abstinence only environment, 12-step based. Abstinence is the way, the truth, and the light. No space for, any kind of harm reduction really in that, recovery path. Well, my smoking cessation path opened up the world of harm reduction to me. And it helped me understand, that I was going to die earlier, whether I was using my alcohol or drugs anymore from my smoking. And so if I could use harm reduction as a means to stop smoking, I could see really clearly that that was going to be life-saving for me. And it started to crack open a little bit of what was kind of this abstinence only mindset for me. And there's some other things that did that for me as well, but that was kind of the initial thing. So
Well,
I hope that
first
answered
off,
your question.
thank you, Kim, for that. That's a great. I mean, it's a great overview of not only who you are personally, but also professionally. And I mean, I'd like 9 questions just out of that opening statement that you made. But what's interesting is that kind of how you're illustrating your own personal life, but then also I'm maybe I'm oversimplifying it, but right now there's this I don't know, perfect storm or this collision where prevention and recovery are kind of meeting in the middle, if you will, and it's around this common theme of harm reduction. And again, I may be oversimplifying it, but for many people in our audience, the idea of harm reduction may be brand new. Others may elicit a negative or a positive connotation. So it does, though, seem like that it's here, and you're illustrating how it's been pertinent in your life. And I think that it's pertinent in the future of the prevention, at least of the work I know. So maybe a good place to start is maybe some kind of a definition or an understanding of what is exactly meant by harm reduction.
It's a great question. And depending on who you ask that question to, you might get several different responses. And there are several ways to think about harm reduction, several constructs. What I would say is this: SAMHSA is in the process of defining harm reduction officially for SAMHSA, for SAMHSA grants, for SAMHSA work, for, what we do at SAMHSA. So that definition work that's happening at SAMHSA right now is in draft form. The definition of harm reduction per SAMHSA is in its draft form at this point. Many of you may be aware we held a large virtual convening that brought together many people from the harm reduction community, along with people who use drugs and others who have interest in harm reduction. From that convening, multiple day, large convening, we created a steering committee. And so SAMHSA has a harm reduction steering committee, 17 people on that. A lot of those people have lived experience. They're from all over the country, all over culture, different cultural backgrounds, et cetera. So that group is the group that has kind of crafted the initial draft based on all of this work that's happening. That initial draft then is going out to 34 different harm reduction leaders in the country, just representing an even broader perspective. And then after that comes back, then that definition will be put on for public comment. And you'll look for that on the Federal Register for public comment, probably, maybe around September. And then it'll be out there for 60 days to comment on. So I just want to kind of say heads up, there'll be more information about that, but that's what's coming. So for now, oh, sorry, go ahead.
Go ahead. No, go ahead.
Just lastly, I'd say, so for now, the definition that we use at SAMHSA when we talk about harm reduction is the one that's in the ONDCP 2022 National Drug Control Strategy. So that's the Office of National Drug Control Policy has, this year's National Drug Control Strategy has a definition of harm reduction, and that's what we're functioning from right now. And it is this: harm reduction is an approach that emphasizes working directly with people who use drugs to prevent overdose and infectious disease transmission, improve physical, mental, and social well-being, offer low threshold options for accessing substance use disorder care and other health services. In the context of the nation's overdose epidemic, which we could talk a little bit more about, ONDCP currently defines harm reduction as a public health approach designed to advance policies and programs for people who use drugs based on principles of care, support, connection, and respect. So it's a little bit wordy and lengthy, but if you're looking for that, it's the ONDCP definition for now.
It's interesting that, it's all evolving right now, but in the middle of that, and it was kind of the direction that I thought, well, let's go here next, was where we're at now. You'd have to be, someplace else. I can't imagine to not understand the world has been in flux and change in the last couple of years because of a shared health crisis globally. But in the midst of that is still the pervasive use of substances, mental health issues, suicide rates, mental health issues, those kinds of things. And you mentioned that there's been an increase, especially in the overdose rates. And I know the last time you were on the podcast, you talked a lot with Dave Clausen about kind of the status of all of that. And I don't want to regurgitate all that. If people are interested, you can look for the podcast with Kim and Dave. But since that time, you talked right on the heels of the pandemic. I don't know the exact numbers, but maybe you can talk a little bit about some of that spike in the data, whether it's overdose from chemicals or whether it's suicide or other mental health crises.
Yeah, data is, constantly evolving and has some lag to it. But what we know right now is in the 12-month period previous, over 100,000 people died from an overdose last year. We're talking that number is anywhere from 105 to 107,000 people in 1 year died from an overdose. Now, this is post-pandemic, post-fentanyl America. that we have been incredibly accelerated, with an already horrific overdose and suicide crisis, reducing life expectancy in the United States for the first time in nearly 100 years for 3 years running. So, in a country like ours, you wouldn't expect to see life expectancy dropping off. We are seeing it dropping for 3 years in a row. A big part of that is alcohol-related deaths, overdose-related deaths, by suicide. It's those deaths of despair that we know are happening out there. And just, I would say, lastly about this, estimates of as much as half of non-fatal overdoses go unreported because the community distribution of naloxone, where, folks have that naloxone and they're using it, thank goodness. Also, the fear that people have of dialing 911 if someone's overdosing, even in places with Good Samaritan laws in place. It just really speaks to a huge underestimated, we have an underestimate of the problem. But what it also speaks to is the power of harm reduction to prevent overdose fatality, and the ability of harm reduction to engage people who otherwise don't seek care. One of the data points that consistently we know through our National Survey on Drug Use and Health, or NSDUH data, and it shows this again in 2020, is that 90% of people living with substance use disorder will not receive treatment this year. 90%. That's a data point that has endured since we've done this survey. So the vast majority of people that have a substance use disorder aren't getting treatment for it. We also know that a pretty large percentage of those people who don't receive treatment, sometimes it's because they feel like they don't need it. So that's not an indictment on people living with substance use disorder, but really it's an opportunity to look at our current offerings of how we are treating substance use disorder care and be a little open perhaps to maybe harm reduction can provide services to this overwhelming majority of people who aren't getting care, and maybe prevent them from progressing into their substance use disorder further, into developing, maybe prevent them from beginning new substance use disorders, maybe prevent really expensive or maybe treatment that might not, be the right solution for someone, but of course, then also help prevent death. So, the data is pretty abysmal right now. Fentanyl and its analogs have really changed the landscape of substance use disorders. This is another thing, if you'll permit me for a second to just, talk about, one of the things that has moved me off of this abstinence only approach to recovery. And that is that, we know that folks are using substances now like fentanyl and its analogs, which is, not just in opioids anymore, also in stimulants, really in all of the drug supply is contaminated with fentanyl, basically. So, when I got into recovery, it'll be 31 years. When I talked with Dave last time I was on this podcast, I was celebrating my 30th year of recovery kind of all year. So, November of this year, if I'm fortunate, I'll have 31 years. But that many years ago, 100,000 people were not dying of overdoses when I got into recovery 30 years ago. And the landscape looks different now. And we have to evolve with that landscape. And so to me, this concept of there's some myths about harm reduction. And one of them is that harm reduction enables people to keep using and prevents them from reaching a bottom, right? So that's a myth about harm reduction. I mean, the truth is it does enable people to continue living, to be, parents to their kids, to be family members, to protect themselves from deadly diseases. Harm reduction does prevent people from reaching bottom, because now more than ever, bottom equals death. with fentanyl in the market. Sorry for the noise in the background, printer going. So yeah, I just would say, the landscape's different, and we have to evolve with the current environment. I'm going to tell you, it's basically when we know better, we do better, right? And one of my very favorite quotes in terms of our need to continue to evolve is from Eric Hoffer, and maybe some of you know this quote, but in times of change, learners inherit the earth, while the learned find themselves beautifully equipped to deal with a world that no longer exists. And if that isn't, for me, the perfect sentiment of the evolving landscape that we're in and our need to evolve with it, which I believe bringing harm reduction along into prevention, into recovery, into treatment, into every aspect of what we do. Essentially, harm reduction fills gaps between prevention and treatment and recovery, and it means that we can have everyone always engaged in a system of care, no matter where they are along that continuum. So hopefully that answers that question a little bit.
I like that that it provides a system of care across the continuum, because I'm looking at some of the notes that you and I exchanged before we got the date nailed down to do this podcast, and one of the statements in there was the epidemic issues we're facing: opioid, stimulant, fentanyl, suicide, increase in mental health issues. We're at epidemic or crisis status nationwide, if not globally, when you also add to that a pandemic that we've all been faced with. And somehow or another, it seems to me that, again, what's at the core of this is, just like there's no one size fits all when it comes to recovery, and you've helped to try to illustrate that, there's certainly no one size fits all when it comes to prevention, because I'm old enough to remember that the message was just say no. For some people, that is a finite statement, and there's no more after that. For others, it's not. And that's what prevention is, I think, finding the grace to be able to find ways to reach an ever expanding audience that needs to hear about not just substance use prevention, but a whole host of other epidemic crisis that we're facing in our community. And this term harm reduction, you mentioned naloxone, a PDMP, those kinds of things are examples of harm reduction. And then you can go to other examples, as you've illustrated with smoking, and then you could go to other extreme examples of harm reduction with safe use sites or needle exchanges, whatever that looks like. It's a one size fits all, doesn't cover it. But I'm wondering, in the work that you're talking about with, let's say, the harm reduction panel that you referenced, are they addressing within that some of this, what seems to be pervasive, which is the stigma around addicts or mental health or suicide, all of those things that we keep in Pandora's box, so to speak? Is that a part of it? And do they see a correlation between that stigma and kind of opening the door on harm reduction as a potential answer to some of the issues we're facing?
I think that's a really good point to call out how harm reduction can beat back stigma. Stigma is just so entrenched in our beliefs, in our systems, at policy level. I mean, it's just at every level. It's so, it almost seems intractable. But what harm reduction does is say, first, you're a human being. Whatever things you have going on, whatever's happening in your life, whatever choices you're making, we first see you as the human being that you are. And we want to meet you where you are, wherever that is. We've talked about the stages of change a million times, but, do we really apply? Maybe someone is even pre contemplation, it's they're zero at zero level. What whatever. We have in this modern kind of era post-COVID, we have a crisis that demands novel and innovative approaches. This is like all time for all hands on deck. And what harm reduction offers is the very lowest barrier of services. There's nothing much you have to be willing to say or do to receive a harm reduction service, a handout, a person who is in the community providing whatever it is that will make you able to make any positive change, to not die from your substance use. And now is the time, I would say. I would also just put out that I think harm reduction doesn't take anything away from prevention. It only adds something to prevention. It doesn't, there's nothing that is contradictory between harm reduction and prevention. What it does is add value, to prevention coalitions, for instance. Wouldn't I hope that every prevention coalition I visit, which I visit them regularly, I'm heading out to one in the Springfield area sometime in September, pretty soon, in Marshfield, I think it is, right? Is that the name of the town? Yeah. So, and I hope when I get there that I see that there is someone from the harm reduction community at that table, that whoever the harm reduction folks are, that they're at our prevention tables, that they're at all of our tables, that they're connected to our treatment services in all ways, shapes, and forms. Because who are we to say what is the right approach to reach someone? And with 100,000 people dying a year, it's all hands on deck. We need all approaches.
It really is. It's a community issue that we're having to face. And I'm not even going to put that, I can pick any one of those epidemic issues that I listed off. It really is a community issue that we're facing. And I certainly don't have the answers. I've learned that in life. I don't know that I have the answers, but I know that it takes an awful lot of tools in the toolbox to find some solutions. And I think that what we're in the business of doing, whether it's at the very beginning of the continuum of care or all the way towards the very end, we're here trying to save lives and do no harm. And I think that maybe that's where we're at now, because we have to start asking some new or some innovative questions to address an ever-growing issue in our community. And my grandmother used to say that when things get really bad, everybody all of a sudden seems to decide that what we need is community. And I couldn't think of anything that would better illustrate what we're talking about. Is we need community to solve these problems.
Yeah, we do.
I always leave room towards the end of the conversation for my guest to leave us with a parting thought or a call to action in some place. Maybe there's a website or materials that you can reference, anything that you feel like we didn't discuss, or that you would say, of all the things we did discuss, this is really what I would like the audience to take away today.
Oh, it's hard to narrow down to one or two things on that. I guess, I hope everyone knows on the SAMHSA website, we certainly have, a page on harm reduction. So if you want to know where SAMHSA is in the process of defining harm reduction, we have awarded grants for harm reduction grants at SAMHSA. We just sent out kind of the first round of those. I'm happy to report we have one of those that's been received in Region 7. Some of you may know it's at the KC Care Clinic. They actually have formed a harm reduction coalition of Kansas City is what they're called. And so it's a partnership between KC Care Clinic and First Call, as well as the University of Missouri, Kansas City, looking at how they can increase their reach in harm reduction. So anyway, so the SAMHSA website, harm reduction, I hope people also know in this region, especially, that you can reach out to me directly anytime to ask about this, talk about this, have a conversation. I will always tell you kind of what I know is the latest about any of these topics. And, I'm easy to find in email and on the website. And I think my parting words, would be, and maybe this is, I don't know, whatever. I don't need to characterize it, but to me, harm reduction is just really, if I was going to define it in one word, it would be, maybe love or just compassion. And you can't love someone too much. Sorry. Even if you're worried about enabling, certainly we need, boundaries and all that. But again, that to me characterizes harm reduction. Really, it's about love. So maybe not the official SAMHSA, definition, who knows?
It'll do till one comes along.
That's right.
Well, Kim, thank you for being here. And I'll just put it right out there. I would hope that you'll come back and have a conversation with us again from the SAMHSA perspective and about this topic or others as they unfold. But you're welcome here anytime, and I hope you will come back.
Thanks again for having me, Steve. And thanks to all of you out there who are listening, who are doing the hard work on the ground in communities, saving lives. Really,
we will put the website you referenced for the SAMHSA's harm reduction site. I'll put your email in the show notes as well, and maybe a couple of other places that the audience can go if they want to learn more or to connect with you. But again, thank you very much for being here. And thank you for listening to this Mid-America PTTC podcast. To learn more about any upcoming trainings, visit pttcnetwork.org and look under your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.